Hello friends, I am Dr. Vani Puri, obstetrician and gynecologist and also Secretary IMA Ghaziabad. Today I am here to talk about this pandemic COVID-19 disease. As we all know that India is going through the second wave of COVID-19 pandemic and it has been proven more deadly. So COVID-19 is caused by a RNA virus, that is coronavirus. If we turn off the pages in the history, this virus has caused more epidemics also, as SARS and MERS. SARS in 2002 and MERS in 2012. So friends, how do you know that somebody is suffering from COVID-19 disease? This patient who is suffering from coronavirus infection will have flu-like symptoms in the earlier part of the disease. The running nose, cough, pain in the throat, low-grade fever, lethargy, pain in the muscles, body ache, these are the symptoms. But as the disease grows, the fever can be of high grade. The patient can also experience gastrointestinal symptoms such as diarrhea, vomiting, and also at times constipation. The patient can also have urinary symptoms. These symptoms are found in the mild to moderate grade of cases. But when this virus turns to be more deadly and in immunocompromised patient, when the immunity is not good, it can turn into severe disease. In severe disease, we see that patient is having difficulty in the breathing. The patient is restless, doesn't maintain the oxygen saturation more than 94%. Patients who are monitored at home should always do a 6-minute walk test. They should monitor their oxygen saturation before walking and after walking 6 minutes. The difference in the oxygen saturation should be less than 4. If it is more than 4, that is a warning sign that after 24 hours, maybe they can experience a breathing difficulty. In patients who are having oxygen saturation less than 94% or have breathing difficulty, should always seek a emergency medical admission in the hospital. So friends, as we know that lot of people are suffering from this COVID-19 dreaded disease. All the hospitals are kach full. They don't have ventilators to serve the patients. The oxygen is out of stock. So in this era, it is better to prevent this disease from occurring. So for prevention, you should behave in an appropriate way, that is COVID appropriate behavior. That is sanitization, social distancing and mask. Do not forget that. And in case you have contracted that infection, then you should do an early diagnosis, early medication. Do early medication. Don't wait for your reports to come that you are COVID positive. Get a CBC and CRP done. They will tell you to what extent the disease has damaged your tissues. And last but not the least, in case if you are having severe symptoms, you should do an early hospitalization. Seek early medical help. That will decrease your morbidity and mortality. This is not a stigma or social stigma. Ask for help if you want to. So please, this is my request and advice to you all. Now coming to the vaccination. So all of you who are more than 18 years should get vaccinated. Vaccination doesn't guarantee that you will not be infected. But yes, if you are infected, the severity of the disease will not be that if you are not. the severity of disease in the patients who are infected is less. But you should always behave in a COVID appropriate behavior. That means mask, sanitization and social distancing. Vaccination doesn't give you a certificate that you should not wear a mask, you should not do a social distancing, or you should not do sanitization. So please, in India as of now, the breastfeeding women and the pregnant women are not allowed for the vaccination. So dear friends, I request you all to get vaccinated and to motivate others also to get vaccinated in your family, your friends, to beat this disease, to beat this pandemic COVID-19. And if you have any queries regarding any pregnancy issues or any gynecological issues or any COVID-19 with pregnancy, you can always be in touch with me on Milo platform. Thank you very much. Thank you for patient listening.